In this video, we're going to be talking about macular degeneration, what it looks like, how it affects someone's vision, and what you need to do in order to be proactive to stay on top of the condition if you're starting to develop it, and what you can do to actually slow down the progression and the development of it. So, what is macular degeneration? Macular degeneration is what happens when someone's macula, if you look at the picture of the retina here, it's the very middle of the back of the eyeball that's responsible for your most high definition sensitive vision. There's a lot of photoreceptors in there that are responsible for sending vision on over to the optic nerve back to your brain. So the macula is where your best central viewing vision is. It's what you use when you drive, when you look at things far away, what you look at when you watch movies, TV, read up close even for that matter, books, computers, anything like that. So the macula, what happens is it actually just breaks down. This is due to a buildup of lipids, proteins, and metabolic waste products that collect on the outside of the retina as time and birthdays go on. There's usually two forms of macular degeneration. There's a dry version and there's a wet version. So we're going to start by talking about the dry version first. So what is dry macular degeneration? Dry macular degeneration is when you get drusen on the outside of the retina that kind of builds up and collects in like these little speed bump looking things. They look like yellow bumps, lumps from the examiner's standpoint. And that can actually distort and fuzz up somebody's central vision when you're looking at faces or when you're reading or when you're driving. Anything like that is what it can really start to mess up. Unfortunately, there's nothing you can really do with the dry stage of macular degeneration other than two things. One of which is it's been scientifically proven by several studies that the two ingredients lutein and zeaxanthin are critical to slowing down the progression and development of macular degeneration, and in some cases can actually halt it if it's an early enough stage, because your macula requires a high amount of metabolic nutrients, minerals, and vitamins, specifically lutein and zeaxanthin. So that's the first thing you can do. The second thing you can do is make sure if you're outside for extended periods of time in the sunlight that you wear good UVA and UVB protected sunglasses, because what happens is if UVA can slip through the eyeball and get to the retina, cause accelerated ultraviolet radiation damage to the retina, that is what can set off dry macular degeneration to progress into wet macular degeneration. So it's really important you keep those two things in mind in order to keep the maculas healthy, going, and not break down near as much. And another thing you're going to want to be mindful of is to make sure that you watch your health history. Are there new diagnoses of diabetes, blood pressure, other health conditions can lead to accelerated developments of macular degeneration. So you're really going to want to stay in touch with your doctor, your primary care physician, to monitor your health and do everything you need to do. Eat lots of leafy greens, fruits, nuts, vegetables, all the stuff to keep the blood flow healthy and going. That's what I tell my patients all the time. So that's the dry version of macular degeneration. What about the wet version of macular degeneration? Is the macula really wet? Is there water stuck in there? No, that's not what's happening in this case. What happens in wet macular degeneration is that the macula becomes so broken down and is so deprived of oxygen, new blood vessels will sprout up and grow from the back of the retina or behind the retina, coming up into the retina, sprouting like a tree basically. And your body's trying to provide new oxygen and get rid of carbon dioxide through those new blood vessels, but they weren't really supposed to be there in the first place. It's just kind of a side effect and an aftermath event basically. Those new blood vessels can cause blood leaks and cracks and cause blood and plasma and fluid to leak up into the retina to cause more significant visual damage to the retina, as well as your eyeballs, as well as the macula. And what needs to happen at this point is usually we as optometrists, or even ophthalmologists for that matter, will refer patients to retina specialists. And even ophthalmologists will do this sometimes too, whether it's an ophthalmologist or retina specialist. Ophthalmologists and retina specialists will do injections of the eyeball to slow down and reverse that blood vessel growth with what we typically call anti-VEGF molecules, anti-vascular endothelial growth factor molecules. These are conditioned monoclonal antibodies, which are basically white blood cells that have been trained to go in and reduce and remove the new blood vessel growth and neovascularization, which is the same thing as blood vessel growth. So that's what needs to happen. Sometimes there's some laser stuff that needs to be done if it's too far in the periphery and the injections won't really get out there. But if it's limited only to the macula, those injections reverse the new blood vessel growth to keep the eyes healthy and keep the macula stable and not allow new vision to be compromised with new blood vessel growth. It's really important you stay in touch with your local eye care professional in order to be able to keep the macular degeneration stable, at bay, healthy, or if you need to see a specialist to have that referral put in the pipeline in order to be able to get to the right person that can take care of your eyes. If you like this video, give it a thumbs up, subscribe to the channel, and tap the bell for notifications. I'm Dr. Bryce Heffington. We'll see you next time.